Welcome to the final section of our video on how to reduce the risk of some of the most common injuries in squash. Today we're going to focus around the foot and ankle. In my opinion, the best place to start will be with your typical ankle sprain or a lateral ligament inversion injury. The nature of squash, which demands plenty of agility, so fast-paced change in direction, means that there is always a risk of sustaining this kind of injury. When we go over on our ankle, we sustain a sprain or a tear of variable severity to the ligaments that support the outside of the ankle. The most commonly affected ligament is the ATFL, followed then by the CFL. Unfortunately, there are a number of complications that can occur when we sprain the lateral ligaments. For example, we may bounce into an eversion injury and sprain the ligaments that support the inside of the ankle. We may sustain an avulsion type fracture to either the fifth metatarsal bone or to the tip of the lateral malleolus, which is at the bottom of the fibula, or we may sustain a sprain to the syndesmosis, which is the connective tissue that sits between the tibia and the fibula. In order to reduce the risk of this kind of injury, we ideally should couple up exercises that work on control around the hip with those that work on strengthening the muscles that support the outer ankle, and load them in a way that replicates the way they are going to be used when playing squash. So I've put together a couple of exercises to do exactly that, and I'm going to start off with some basic squats and lunges. If you've watched some of my previous videos, you will have seen that I like to use these therabands or pieces of band around the outside of my knees when I'm performing a squat, and I'll reiterate the reason why. It's so that we are engaging the more deeper control glute muscles around the outsides and a little bit more when we're performing the exercise. So, the principle behind the squat and the lunge, yes, is working on proximal control. The reason I'm doing it on an uneven surface is to challenge my balance a little bit more and place a little bit more work through a lot of the deeper control muscles that sit more distally around the foot and ankle. So, coming down into a squat. Just maintaining a small tension on that band as we do that to engage those gluteal muscles, and we're also gently tucking in our tummy muscles all the while we're controlling this exercise. Okay, I'm going to then move on to a lunge, for which I'm going to take that band off in this case. And doing the lunge obviously works a lot more on single leg control. So, as I've mentioned in previous videos, wherever you can progress onto single leg control, it's excellent for the squash player. So, lunging down, gently tucking in tummy muscles. We're just going to perform the drop down lunge, so none of the other lunge variations that I practiced in the first video, but if you can control them, by all means give them a go. So dropping down, straightening back up again, remembering not to let that knee fall inwards towards the middle as we do so, to make sure that we're working on control around these glutes. And if at this point you want to just zoom in slightly on the foot itself, you'll start to notice one of my key balance mechanisms, and essentially you're seeing my foot rocking inwards, outwards, forwards and back, trying to maintain balance around the foot and ankle. And that is evidence of all those muscles that support it having to work really, really hard to keep it steady. Now that's what we're wanting to achieve, because we're trying to strengthen those particular muscles so that they can cope with sudden uncontrolled movements like going over onto your ankle. Therefore we're minimising the risk of going over onto your ankle. Okay, so that's your first one. Second one is a single leg stand. Now, single leg stand is an excellent exercise for using across all sorts of conditions and ages, whether you are an up-and-coming squash player or a more elderly person trying to reduce the risk of falls. The most basic level of single leg standing, holding onto a surface not too tightly, just having something to control you and keeping yourself stable. Now when you're doing this as an exercise across all the different variations I'm about to show you, make sure that you can control it more proximally by not letting the hip fall downwards. Keep your hip as level and stable as possible. If it helps, imagine you've got a spirit level sitting across your hip. You're trying to keep that bubble right in the centre of the spirit level. If you are able to cope with this, take your hands away from the wall, Keep yourself in a nice stable position again and work as so. And again, if you're able to manage that, start to progress up into using an uneven surface like we've just done for your lunges and your squats. Any sort of exercise where you're challenging balance, gently tuck in the tummy muscles, because as I've mentioned in previous videos, if we've got control around our core, then we are more likely to be able to control movements around the distal lower limb as well as the upper limb. And again, if you can manage it on an uneven surface like that, I always like to throw in coordination where possible between the upper limb and the lower limb. Obviously, squash is a sport that demands a lot of upper to lower limb coordination in so many different aspects of the game. So I've got a ball here, squash ball. You can use any kind of ball that you've got access to. You're going to work on single leg standing and throwing and catching the ball at the same time. If you're coping alright with just a basic throw, start to throw in different heights, catching lower, catching higher, throwing yourself further outside of your base of support to the left or right, so that you're challenging your balance even more. And if you've been watching down at my ankle, you'll see that that balance mechanism I was talking about, where those muscles are having to work really, really hard to keep stable, and really having to work there. The final variation of the single leg stand that I want to show you is where we make it really squash specific and a little bit more fun, and you're actually going to just start hitting the ball against the wall while maintaining your single leg stand. I'm hoping that I don't disgrace myself in this situation. I'm sure a lot of people will let me know about it if I do. So, single leg standing. Okay, that's your variation there. Actually quite challenging doing that as an exercise, regardless of how good you might think you are at squash. It's very difficult to do. So the next exercise that I want to show you is landing, so jumping and landing on an uneven surface. The reason I've thrown this in as an exercise is because one of the most common mechanisms of injury for rolling the ankle and sustaining a sprain to the lateral ligaments is losing control when we land. So if we've jumped up for a volley and extended for a volley and then landing uncontrolled. So this exercise is purely working on controlling that landing. So all we're going to do to start off with, your most basic variation, jumping in a straight line, double foot jump and double foot land. If you want to progress that further, double foot jump and a single foot land. And then the final one is single foot jump and single foot land. Just remember, if you are going to perform this as a single leg exercise on one leg, always repeat it on the other leg. As I mentioned in either yesterday's or the day before's video, if you are performing something on a single leg only, you are at risk of developing weakness in the opposite side and therefore increasing injury risk on that side. Now, because squash is a multi-directional sport, we never just run in straight lines. It's useful to do some sideways jumping, maybe even backwards jumping as well. So I'll show you some examples of sideways jumping. So double leg to double leg, relatively straightforward. And then you can do again, you double onto your single leg. Really just start to challenge balance at that point. Now, I've been using a cushion for my uneven surface which is probably going to be the most accessible thing that you've got at home. Some of you might have access to what we call a Bosu ball, which is like a half gym ball. They tend to be excellent for doing these kinds of exercises with, so if you've got one, by all means do use one. So that's the jumping and landing. The next one is tiptoe walking. So tiptoe walking, the reason I've put this into this little circuit, not only are we working on control, balance and coordination, but we're also, by walking on our tiptoes, holding our foot in what we call a plantar flexed position. It's in this position when the ATFL, the ligament that is most commonly injured when we sprain our ankle, is at its most strained, or stressed rather, I should say. So if we are stressing it by doing this exercise, we are in theory increasing its capacity to manage the kind of stresses put on it when we are playing squash, and therefore reducing the risk of going over as a result of deformities within the ATFL. So I'm going to show you two variations. The second variation is going to require a towel, and the thing that I've got is a bunch of rolled up socks. Doesn't have to be. If you've got multiple pillows, you can use multiple pillows. I just think this works a little bit better. So first variation before we move on to that is just doing it on a flat surface. So I'm coming from here. I'm doing it in tandem, so I'm going one foot in front of the other. If you really want to challenge your balance and coordination, start to go backwards. Okay, level 2 then, onto that setup that I've just mentioned, and you've really now got an uneven surface that you need to work with. Okay. So that's your tiptoe walking. The final exercise that I want to show you as part of ankle sprains and reducing the risk of ankle sprains is what I call star excursion. Now, star excursion is an exercise that I use for the rehabilitation of a number of lower limb problems, so not just ankle sprains, and the reason for that is that it challenges what we call proprioception. Now, I think I mentioned proprioception in yesterday's video, if not the video before. Proprioception is effectively the body's awareness of its own position in space. And the ligaments that sit on the outside of the ankle and those that sit on the inside of the ankle provide a lot of feedback to the brain so as to tell it where it's positioned in space. And a lack of proprioception within those ligaments can therefore lead to you being more susceptible to spraining that ankle. And this exercise is an excellent way of working on balance, yes, but also proprioception of those ligaments. So you're going to stand on a single leg, and with those rolled up socks, if you've got magazines on a slidey floor or towels on a slidey floor, that would be also ideal. You're going to work on pulling those in one by one and pushing them out one by one. If you really want to challenge balance and certainly proprioception, according to theory, shutting your eyes might also be a useful technique. I'm going to give this a go at shutting my eyes. It really isn't easy at that point. Okay. In theory, shutting your eyes is a good way of progressing any of those exercises that we've just gone through, so as to work on proprioception at the same time as proximal control, distal strengthening, balance, coordination, and stressing the ligaments that support the ankle. Okay, so put those back. That's everything for ankle sprains that I'm wanting to discuss today. Next up is a condition known as plantar fasciitis. Plantar fasciitis is an inflammation or an acute thickening of the soft steel-like tissue that sits on the bottom of the foot, and in particular at its enthesis where it attaches to the heel bone. One of the most common mistakes when treating plantar fasciitis is to roll the bottom of the foot over the top of a cup of ice or a cricket or a hockey ball, as some people like to use. Now, while that might have some short-term effects on pain relief, it may also have an adverse effect on your pain, and it will make no lasting changes to the affected tissue. The plantar fascia is effectively a continuation of a number of muscles which ultimately terminate in the foot. For example, the tibialis posterior, the flexor hallucis longus, and the intrinsic muscles of the foot. Therefore, in order to reduce the risk of plantar fasciitis, the best way of staving off this condition is to load those muscles and keep them strong so that they are less likely to be overwhelmed by the impact demanded on them by squash. It should also be noted that being heavy-footed on court seems to have a link to this condition, and therefore try to stay light when you are moving around court. So I've put together 3 basic exercises for managing this as a condition. The first one is a heel raise, but with a ball in between the heels at the same time. So, basic heel raise. Using your bottom step if you can. If you can't, just do it on flat ground, that's absolutely fine. And we're not just coming up and slowly down as we've practiced before, we're also going to apply a gentle squeeze to that ball. Tennis ball tends to be quite useful, but if you've got anything like this, whatever you can find really, you're going to work on coming up and slowly down. The principle behind this is that there is research to suggest that if we squeeze that ball gently as we're performing this exercise, particularly on that down phase, the eccentric phase of a movement, then we are placing an increased amount of work through the tibialis posterior. That is one of those key muscles that has its connections to the plantar fascia. So we're strengthening your tibialis posterior. Okay, so second one. At this point I'm going to have to take my shoe off, but I'll spare you the horror of taking my sock off as well. We're going to work on splaying and curling the toes. Might seem like a really strange exercise to be doing, but I'll explain it as we go along. So all we're going to be working on is splaying the toes wide as you possibly can, and then curling them inwards. Splaying the toes wide, curling them inwards. Now the principle behind this exercise, when we curl the toes inwards, we are contracting against the tendons of the flexor hallucis longus, as well as the flexor digitorum longus, which again has its connections to the plantar fascia, and we're working some of the intrinsic muscles of the foot, such as the lumbricals. So essentially, we're strengthening those ones that have their connections to the plantar fascia. Now, if you experience or if you suffer with cramp in the bottom of your foot regularly, then it might be worth practicing this kind of exercise as well, because cramp in the bottom of the foot is often a sign of purely weakness within those muscles on the bottom of the foot. So we're just working on splaying and curling, maybe holding for a few seconds isometrically before then splaying out wide. Okay, so final exercise I'm going to show you, or final variation of exercise I'm going to show you is essentially a foot raise. I'm going to differentiate this, or between this rather, and a heel raise, and a typical heel raise. And I'll show you what I mean by a typical heel raise to start off with. So, typical heel raise will be as so. And essentially what we're doing here, in physio we talk about having a tripod in the foot, or a foot tripod, where we have 3 key contact points with the floor when the foot is in any weight-bearing position. Those 3 contact points are the head of your first metatarsal, the head of your 5th metatarsal bone, and the heel bone. And when we do a normal heel raise, we're just lifting the heel while maintaining contact with the 1st and 5th metatarsal heads. What I'm going to do as an exercise here is what I'll call a foot raise, where we're lifting all 3 of those contact points, of those foot tripod contact points, away from the floor. We're just maintaining contact in the tips of the toes. So we're lifting upwards, holding isometrically, and then very slowly lowering downwards in as controlled a fashion as you can manage. Now by doing this, we're stressing a lot more of the intrinsic muscles of the foot and a lot more of the deeper muscles in the posterior compartment of the leg. So not necessarily your calf, the gastrocnemius, the soleus, but more your tibialis posterior, your flexor hallucis longus, and your flexor digitorum longus. So we're lifting that foot all the way upwards. and slowly lowering down. And if at this point, if you're doing this exercise, you actually place your hand on the bottom of your foot, you can actually feel those tendons and muscles contracting, feeling nice and tight, so you know that you're working the right sort of bits. Again, we're working on muscles and tissues that are connecting to the plantar fascia and reducing the risk, therefore, of developing a plantar fasciitis. Now that, even in sitting, is quite challenging for me. If you can, and I'll be impressed if you can, but I'm going to give it a go here anyway, you can do this in standing as well. So in standing, I'll probably recommend having some sort of base of support against a wall. Typical heel raise, I'll just show you again, is lifting just the heels, but this time we're going to come all the way up onto the toes and slowly down after a few seconds. So lifting up all the way onto the toes and slowly down. I'll just do a couple more to show you what I mean. At this point, those tendons that we're trying to work on are starting to give in for me. They're really starting to fatigue. So I'm going to stop there after that repetition and accept that that's probably as much as they're going to take. So, while I'm having these shoes on, I mentioned at the start of this section on plantar fasciitis that one of the most common mistakes is by treating it through rolling over a cup of ice or a hockey ball. Now, I'm not necessarily completely against doing that. If it is having a positive effect on your pain in the short term, then I have got no problem with you doing that, but in supplement to these kind of exercises. These kind of exercises should be the primary mechanism of either treating it or reducing the risk of it, as we are trying to address in this video. Essentially, all you're doing by doing the rolling over the top of the can is masking the symptoms. So similarly to if you were to take a paracetamol or an ibuprofen for masking the symptoms of a cold, it's not actually treating the condition, but it's maybe helping you to manage it a little bit better. So I don't mind you doing it, but the only time I would advise against doing it categorically is if it is adversely affecting your pain, if it's making it more painful. And there is no point in doing that if it is making it more painful. Okay, so that's everything on plantar fasciitis. The final condition, and potentially the most scary condition that I'm going to discuss today, is Achilles tendinopathy. Similarly to patella tendinopathy, as we discussed yesterday, an Achilles tendinopathy is a derangement of the tissues within the Achilles tendon, normally through uncontrolled overuse, which can therefore cause pain when we are running, playing squash, or even when we're walking. Achilles tendinopathy can affect you higher up in the tendon in its mid portion, or it can affect you more distally into the tendon where it inserts into the heel bone. It is very rare that a tendinopathy will therefore be a precursor to rupturing the tendon. It's important to remember that point. Only in the more severe or degenerative cases is that a real risk. It's important to remember that if a tendon is going to snap, it will have happened before you, or you will not know about it until it's happened, essentially. It's very rare that a tendinopathy goes on to result in a rupture. It's going to happen unexpectedly, is the best way of putting that. The best way of minimising the risk of developing pain within the Achilles tendon is to load it so that, again, it is strong enough to cope with the demands placed on that tendon by playing squash. I've recently read a piece of research that outlines a spectrum of basic exercises that helps to progressively load the Achilles tendon, and the following exercises are somewhat derived from that. So the first one is actually just walking. I'm not going to waste time by showing you how to walk, but my advice would be to walk fairly often, whether it's a recreational walk, as we're just about allowed to do at the moment, down to a park or on a public footpath, whatever you want to do. I would do that regularly so as to load the Achilles tendon. The second one, I'm just going to make sure I'm going in the right order here, is putting the feet together in a feet together stance. Now, to be honest with you, at this point, I will probably only be using this in a more severe case, but by all means give it a go anyway. So feet together stance, believe it or not, is actually starting to load through those Achilles tendons at the back, but in a very small way, so I'll probably only be using this in the more severe cases, not necessarily to reduce the risk of developing it. Okay, the next one is working on squatting. So again, my favourite little thing, I'm going to bob this around my knees. And working on squatting, I'm just going to go sideways on so you've got an idea of why this is actually loading through that Achilles tendon. So as I come down into this squat with the correct technique, so not by doing this sort of thing, by actually imagining you're sitting down into a chair behind you, you can see on that down phase we're starting to lengthen through that tendon. Okay, so that was the third one. The fourth one is a bilateral heel raise, so I'm going to use a step again, but if you haven't got a step you can do it on flat ground, that's absolutely fine. So at this point, just while I'm doing this as an exercise, I'm going to talk you through a bit of research that was done by someone called Alfredson a few decades ago. It's a piece of research that has sort of stood the test of time really and is still quite applicable in practice today. Alfredson essentially said that in order to treat Achilles tendinopathy, he would treat his patients with a regime of 180 of these exercises, of these heel raises and drop downs, 180 times in the day, 4 times throughout the day, so split into 3 sets of 15, and again 4 times a day to make up the 180 reps. He would recommend that we did a combination of straight knee repetitions as well as bent knee repetitions, so as to differentiate between the gastrocnemius muscle and the soleus muscle, the 2 big ones that sit in your calf group. So working up and slowly down. I'm not, by the way, suggesting you have to do that regime. That was just essentially the big piece of evidence that a lot of this work is somewhat based on. Okay. The next one in that spectrum is a tandem stance. So tandem stance is just one foot in front of the other. And again, believe it or not, you are actually putting a fair amount of load through the back Achilles tendon as you are doing that as an exercise. Now some of you might think that's a little bit fraudulent just to call that an exercise, but it is loading through that tendon, and even just here, me concentrating on it, I can feel that tendon having to work quite hard. Again, if you want to challenge your balance, you could do it on an uneven surface rather, so using pillows, Bosu ball, rolled up socks, whatever you've got access to. That would be that. The next one on the spectrum was jogging. Again, I'm not going to waste camera time or embarrass myself by jogging inside the garage, but getting out jogging will be a useful way of doing it on a fairly regular basis so as to load the tendon. The next one, going back to your heel raise, so going again up in that spectrum of progressively loading the Achilles tendon, will be to come up bilaterally into the heel raise, so with both feet, shifting onto the single leg, and then slowly lowering down just on that single leg. So we're really starting to load eccentrically through that tendon as we do it. Remembering to perform that on both sides. Okay. The next one to practice is lunging. Again, all of these exercises seem to be tying in together, but lunging, an excellent way of loading up the Achilles tendon. So working on coming down into the lunge, and again, loading eccentrically through that side. If you're doing it correctly, you are actually loading through the back leg as well. So you're letting the knee drop down and back up. It's important to remember that we are working on proximal control here. So again, as I mentioned in yesterday's video, as I've been mentioning repeatedly today, proximal control is so important for minimising the risk of injuries throughout the lower limb. Just coming down there into that drop down lunge. I'm going to go back onto the heel raises now because again we're progressively loading, but this time we're going to go up and down on the single leg. Okay. And then the final two that I'm going to show you are a plyometric squat and a plyometric lunge. So, plyometric squat, obviously as we've done in previous videos, we're coming down into the squat, jumping up, and again controlling the landing. So obviously when we're performing that exercise, we've got that explosive movement concentrically going up through the Achilles tendon, and obviously controlling that landing phase, lengthening it out eccentrically. Working then into single leg control, really pressurising that tendon now, the plyometric lunge. Okay, so there's loads of other ways of doing it, but the piece of research that I recently read seemed to detail a number of those exercises in that kind of order, again for progressively loading up the Achilles tendon. So that concludes our mini-series on how to keep squash fit during the COVID-19 pandemic. Thank you all for taking part, and with any luck you'll all come back in prime condition, ready for when the courts reopen as soon as we're allowed to do so here at Pontefract Squash and Leisure Club. If anyone has got any questions or needs any individual advice, as always, drop me a message, I'm more than happy to help. But otherwise, stay safe and hope to see you all soon. Cheers.